Hello, how are you doing today? Yes, how may I help you? You're here for your hearing test, isn't it? Okay, let me just take a look. And your name is? I have your records over here. This is your first visit with the clinic, but I see you've already pre-filled all the information online. Okay, your name, your address. I'm just making sure that everything is in order so we can get straight to business. Okay. Can I just ask, I see you haven't filled it out here, your general practitioner's name and address, please? Okay. Oh yes, that's quite nearby. So they recommended you to come here. Okay, and can I ask why is that? What exactly disturbs you? What is the problem? Okay, and how long has this been going on? Okay. Okay. Right. Well, I think the best thing to do in this case is we're going to check your hearing today. First, I'm going to ask you a few questions, and then I'm going to just check your ears, and then we're going to do the hearing test itself. Is this okay for you? Okay. So you're ready for the questions? I have the questionnaire here. Okay. So just answer as honestly as you can to the best of your ability, okay? Right. So nowadays, do people seem to mumble or speak in a softer voice than they used to? Do you have difficulties following conversation in a noisy surroundings, like in a restaurant or at a party? Do you find yourself asking people to repeat what they say? Okay. And does it happen very often? Or does it happen with a particular person, perhaps? Okay. Do you find that you need to turn up the volume on your TV so that others comment on its loudness? Okay. Do you sometimes avoid taking calls on the telephone because it's difficult to hear what people are asking? Okay. And again, is that usually with any particular people, or is it just... Do you have difficulty pinpointing the direction or where a sound is coming from? By the way, a lot of those things we are going to check today as well. Has someone close to you mentioned that you may have an issue with your hearing? Okay. And again, I have to ask you, is there any particular person that is... Do you feel you use a lot of effort just to follow everyday conversations? Okay. Do you feel you have to strain to hear everything that is said in a meeting? Say if you have a group of people get together. Okay. We're almost done with the questions, don't worry. Do you feel that you are missing out on activities, events you used to enjoy due to problems with hearing? Okay. Do you sometimes answer a question and realize afterwards that you did not understand the question correctly? And this is to do with the hearing. Not as much with an accent or if somebody's speaking in a different language. Do you feel you must really concentrate to hear someone talk or whisper? Okay, and again, is that any particular people? Okay. Okay, so right, so just by your answers, yeah, I have a picture of what it might be, just a little bit, but we're gonna go through the whole hearing test, and the results are gonna be ready pretty much straight away. I'm gonna tell you the answer as soon as I finish. Okay, so first thing is first, I have to actually examine your ears. Is that okay? I'm gonna look at your ears, just shine a bit of light in there and examine. Is this okay? Okay, I'm not gonna wear the gloves. So in this situation, we always check your fever, whether you have the temperature. That's the first thing. Okay, so I have my thermometer over here. It's already preset. Let me just check it. I usually check it from both ears, okay? Okay. It sounds okay. Now just the other side, please. Just relax. It doesn't hurt, does it? Okay, you have no fever. Now I'm just going to examine your ears inside. Just relax. It's nothing painful. Okay. Right. Just from the other side as well. So I see no inner damage or anything. Everything seems in order. You might have a bit of a build-up in wax from what I am seeing. But obviously we are going to run the test, the actual hearing test. So what I'm going to do, just to explain it to you quickly, I am going to put the earphones on your ears, and then I'm going to use the microphone close up, just to examine and play with different sounds. I need you to tell me where you're hearing them from. I'm going to repeat this, so okay, you ready? I'm just going to put them on you. Right, so now it's all set up. You should be able to hear me through your earphones, so my voice would be quite a little closer. Okay, I'm going to record everything in here as well. So basically what I need you to do right now is whatever I'm telling you, whatever you hear me saying, I want you to repeat it back to me, the words. If you can't hear anything despite my mouse moving, you need to raise your hand, okay? Are you ready? Okay. Train. 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 imagination, imagination, television, bird, bird. Okay, I will keep going, so you might be able to hear less and less. And just because you hear less, it doesn't mean that you have any problems. It might just be that my voice is actually inaudible, okay? I just want you to repeat the word just as we were doing so far, okay? But for now, I want you to actually close your eyes, okay? Just close them. Right. Are you ready? Okay, eyes are closed. Towel. I want you to now tell me as well which ear you're hearing it, okay? Speaker. T-shirt. C. Floor. Tasty. Tasty. Sofa. Quiet. Quiet. Loud. 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 Now I am going to just make the sounds. Those are not going to be the words, they're just going to be sounds. All I need you to do is lift the arm for which ear you can hear it, okay? Sounds good? Good. Bear in mind, sometimes you might be hearing it in both ears. Or sometimes it's less, sometimes it's more in one or the other. Okay. You can relax and open your eyes for this minute. So far so good, I must tell you. Now we're going to continue on, and I'm going to use these two pens just to make a sound, okay? And again, I'd like you to just lift your arm whenever you hear something, okay? From which ear, okay? Ready? Of course, you have to close your eyes again, okay? Because obviously otherwise you can see that very much influences you as well. Okay? Okay. Looks good so far. Now, last test, I'm gonna put my gloves back on. Keep your eyes closed. I'm just gonna make sounds with my hands. Okay? And after this, you can relax. Okay. Again, the same thing works. I'd like you to tell me from which ear you can hear it, okay? Okay, ready? Yes, okay. Can you hear it? Can you hear it now? Can you hear it now? Okay, and which side? How about now? Can you hear it now? And now? And which side? Okay, and now? And now? How about now? Okay, this is very good. Excellent, you can open your eyes. Okay, so I do think that you have a bit of a build-up with your earwax, which needs to be cleaned. So I'm going to schedule you for an appointment to clean your ears, but apart from this, I don't see anything else being wrong. You do seem to have a problem with one person in particular, but that could be just their tone of voice, their accent. Could be a variety of different reasons really why it happens with this particular person. But in general, I see nothing else being wrong. So I'm just gonna schedule an appointment and then you're good to go for today. And do you have free time next week perhaps? Friday? Friday we have... There is a 1:15 p.m. or 8:35. Which one suits you better? Okay. This is perfect. That is good, yes. Yes. So we are looking forward to meeting you here again at 8:15 next Friday. Thank you very much for coming.